Congress is debating the Price Transparency Act, which is really landmark legislation which allow patients to know how much healthcare costs before they show up in the doctor's office. 8 out of 10 Americans want to know the price before they go to see their doctor. If a patient were to go to an insurer, they could get a personalized estimate of how much things would cost so that they know if there are better deals in or even out of network for the first time. We don't want people not going to get the care that they need simply because they don't know how much it costs. Prices vary by where you park your car, the parking lot. So let me give you one example. Paula Bennett is in her early 50s and suffers from Crohn's disease. Her infusion therapies at the hospital cost $40,000 per treatment, which are every 8 weeks. She was paying a $30 copay for every visit. Even with generous insurance, the costs added up and the premiums increased the next year. Price transparency allowed her to switch the parking lot where she was parked and save $36,000 per treatment. That's the power of price transparency. Going forward, for our economy to continue to flourish, we need patients to be able to see the inflated rates because every dollar overspent in healthcare is one less dollar for gas, a mortgage, or for a small business that wants to keep their doors open or hire an additional employee. In healthcare, it's the only area in our market in which we have no idea how much something costs before we go forward. Think about going into the grocery store, purchasing a cart full of groceries and having no idea how much it was going to cost till 3 months later. We wouldn't do it. That's why it needs to change in healthcare.